Hello everyone. Today, let us discuss the management of CROUP, which is a very common condition in pediatric practice. So, what is CROUP? CROUP is an acute viral inflammation of the upper airway causing edema of the larynx and trachea. So, there will be edema in this area, in the larynx and the trachea. So, it can cause an inspiratory stridor, which is very characteristic of CROUP. Now, let us see what are the causative agents of CROUP. They are parainfluenza virus, that is the most common. Influenza virus, respiratory syncytial virus, and rhinovirus are other causes. Now, what about the epidemiology and how is it transmitted? It is common in the age group of 6 months to 6 years. Peak incidence around 2 years. Seasonal pattern, it will be peaking during spring and autumn season. And the transmission is by droplet spread. Now, what are the symptoms and signs of CROUP? There will be a preceding coryzal illness, fever, harsh bark or seal-like cough, hoarse voice, inspiratory stridor. The symptoms are worse in the night. So, the patients usually come to the emergency room late night or early morning. Child does not look toxic. There will be an inspiratory stridor or a harsh cough, but it is not a toxic looking child. Now, what are the differential diagnoses of stridor? When a child comes with stridor, what all you will think of? You can divide the causes into acute and chronic. Acute causes are CROUP, epiglottitis, bacterial tracheitis, foreign body. And chronic causes are allergic airway disease, congenital abnormality like a laryngeal hemangioma, laryngomalacia, foreign body, and a laryngeal papilloma. These are the differential diagnosis of the cause of stridor. So, acute causes CROUP, epiglottitis, bacterial tracheitis, and foreign body. Chronic causes allergic airway disease, congenital abnormalities like laryngeal hemangioma, laryngomalacia, foreign body, or a laryngeal papilloma. Now, what are the critical safety warnings in a child with CROUP? You should not, there are some don'ts in CROUP. You should not examine the throat because it may cause acute, severe, or total obstruction. You should not distress the child. You should keep the child calm and comfortable. Now, let's see how you will classify the CROUP according to its severity. You can classify it into mild, moderate, and severe. In mild CROUP, there will be a barking cough and a mild stridor, which is not usually at rest. Only when the child cries or during exertion, there will be a stridor. There is no chest recession, no cyanosis. So, we said we will check for cyanosis, recession, oxygen saturation, and stridor to classify the severity. Coming to moderate CROUP, there will be intermittent stridor at rest. In mild, there is no stridor at rest usually, but in moderate, there is an intermittent stridor at rest. Mild chest recessions, child will be alert and responsive. Coming to severe CROUP, there will be stridor at rest, continuous stridor at rest, cyanose shy, oxygen saturation low, that is less than 92% in air, and moderate to severe recession along with an apathetic or restless child. So, in mild CROUP, there will be a barking cough and a mild stridor. But in severe CROUP, there will be stridor at rest, cyanosis, recessions, and low oxygen saturation along with an apathetic or a listless child. Now, what investigations you will do in CROUP? You all know no investigations are necessary. It is a clinical diagnosis based on history and examination findings. Now, how you will manage a case of mild to moderate CROUP? There are 4 main things. One is analgesia, then hydration, corticosteroids, and observation. So we'll give analgesia, hydration, steroids, and observation. So for analgesia, you can give paracetamol or ibuprofen. Ensure adequate fluid intake. Steroids, what you will give? Oral dexamethasone, 150 microgram per kg. And observe. Admit or observe moderate croup for at least 4 hours and reassess. So, about the steroids, dexamethasone can be repeated after 12 hours. If you are admitting the child, you can give dexamethasone. Or if you want to discharge, you give a single dose of oral prednisolone 1 mg per kg to take 12 to 24 hours later. Now we have seen the management of mild to moderate croup. Now let us see how you will manage a case of severe croup. First and foremost is to keep calm. Keep child and parents calm. And child should be nursed on parents' lap in the most comfortable position. And you should give high flow oxygen, 15 liters per minute, via mask with reservoir bag. But if the child is fighting when you give oxygen, you better avoid. Keep the child calm as much as possible. But when the saturation is low, we have to give oxygen. Try to pacify the child and give oxygen. And dexamethasone, you will give same 150 microgram per kg orally. Or if the child is not taking orally, you can give nebulized budesonide 2 milligram. And in severe croup, you will give nebulized adrenaline 1 in 1000 undiluted form, 400 microgram per kg to a maximum of 5 milligram. In ml, if you say it is 0.4 ml per kg up to a maximum of 5 ml. Usually adrenaline comes in 1 ml ampoules, right? So, you can give it 0.4 ml per kg up to a maximum of 5 ml. So, a 10 kg child requires 4 ml. So, you can repeat after 30 minutes. Now, how you will step up the treatment? If the patient is not improving, you will contact the on-call consultant pediatrician and discuss the involvement with pediatric anesthetist and ENT surgeon, secure airway in theatre by an experienced anesthetist, and transfer to pediatric ICU. What does not help in a case of croup? Antibiotics, antitussives, and humidifier air has no role in a case of croup. So, because it is a viral infection, no role for antibiotics. Antitussives are not indicated and humidified air has no proven benefit. What will help? Encourage oral fluid intake and provide croup information leaflet to parents. So, let us see what discharge advice you will give to a case of croup. So, croup, if you give a nebulized adrenaline, it should be observed in the emergency at least for 4 hours. Then only you will discharge. Okay, in the emergency or in the ward, wherever possible, you observe for at least 4 hours and then only you discharge. So, when you discharge a patient with croup, you will tell some red flag signs to the parents. Advise parents to return immediately if any of the following develop. Drooling. Why? Because it's a classic sign of epiglottitis, upper airway obstruction, which is severe and life-threatening. Labored breathing, persistent fever, biphasic or worsening stridor, increasing stridor or stridor during inspiration and expiration, biphasic stridor, cyanosis, and reduced consciousness or confusion. You will tell parents to come back to the hospital. Otherwise, there is no need for follow-up in a case of uncomplicated croup. So that's all. Thank you everyone and happy learning.